Hello everybody and welcome to the Thursday edition of Video Clips. And just a reminder, those of you who are thinking you'd like to have a career in a health-related field like what we do here, send me an email at pampopper@msn.com. We have 5 or 6 really good training programs, and just a couple things I'll mention to you that I think make our programs different. One is there's a combination of live instruction and online learning, with a lot of live instruction, which I think is really necessary to teach people how to be good at the types of things that we do here. The second thing is we are people who actually do this for a living here, teaching you how to do this for a living, which I think is quite different than an academic discussion of what this might look like in some type of healthcare setting or in your own business. The third thing is that in our programs, you actually have to demonstrate to us that you can do the things that you're learning how to do, or you can't get out. All right, so if you can't, for example, in one of our programs, you have to learn how to do develop and deliver presentations and design cooking classes and review food journals and take a look at the way people are eating and help them change their habits and look at their barriers, the types of things that interfere with people's ability to do better for themselves. I mean, you actually have to demonstrate to us that you know how to do those things or you can't get out of the program. So that's a little bit, I mean, there's no such thing as a guarantee that you'll succeed, but at least you'll leave here with, we will know that you have the skills to succeed. What you do after you graduate, that's up to you. So anyway, if you want to talk about this, send me an email at pampopper@msn.com. If nothing else, I'm happy to share with you our experience in doing this. Whether you train here or not, we've been doing this for 24 years. We're the biggest company in the world that does informed decision making. And so we've learned a thing or two because we've seen a thing or two. I think that's the Farmers Insurance tagline. So I'm going to borrow it for just a minute because it kind of pertains to this issue. All right. Today I want to talk about breast implants, and what's motivated me to do this is a recent FDA hearing that's gotten a lot of attention. So just by way of some background, breast implants are considered medical devices. And by the way, medical devices get very little supervision from the FDA. There are articles in the Health Briefs Library if you want to go read these. Essentially, if you come up with a medical device that's sort of kind of like something else that's already on the market, you get a free pass to put it on the market. It does not require review. I mean, to the extent that the FDA reviews anything. Remember, the approval rate for drugs a couple years ago was 96%. And I've always said I would just love to see the 4% that they're turning down. It must be like intravenous arsenic. And then there's some kind of discussion in the lobby about, hey, we got to look like we're paying attention, submit it next year, we got you covered, you know. So, but anyway, I digress. So anyhow, these are considered medical devices. They're implanted either under the breast tissue or under the chest muscle. They're commonly used to either for cosmetic purposes to increase the size of the breasts or to rebuild them after mastectomy or some type of injury. About 400,000 of these implant procedures are done in the United States every year, and about 75% of them are for cosmetic purposes. And the fact that so many of them are medically not necessary makes what I'm going to tell you that much more important. There are currently 2 types of breast implants which are approved for sale in the United States, saline and silicone gel filled. Both have a silicone outer shell, but they vary in size, the thickness of the shell, the texture of the surface, and the shape, and that sort of thing. Like all medical procedures, there are risks associated with breast implants, and these include the formation of scar tissue around the implant, which can cause pain, changes in the nipple and sensations in the breast, the potential for rupture, and the leaking of the internal contents. Other complications include asymmetry between the 2 breasts and atrophy or thinning and shrinking of the skin around the implant. Calcium deposits can form around the implant, which are sometimes mistaken for cancer when a mammogram is analyzed. Some women experience lymphedema and skin rashes, and then systemic symptoms vary greatly and include things like fatigue, memory loss, rash, and joint pain, and then some serious things which we're going to talk about in a minute. Compression associated with mammograms can cause rupture and deflation of the implant, as can biopsy and any kind of injury due to falls or accidents, even a car accident. For women who have silicone breast implants, time increases the risk of rupture. Most of the time the ruptures are silent and women remain unaware that the silicone is leaking. Eventually, most of them will notice some kind of sign, for example, a decrease in the size of the breast, changes in the shape of the implant, uneven appearance, pain, tenderness, swelling, numbness, or burning. The silicone sometimes remains contained in the scar capsule tissue, but it can sometimes also leak beyond that point and travel all over the body. So at a certain point in time, it's almost impossible to get all of the silicone out of the body if the leaking has gone on for a long enough period of time. Now, the biggest concerns that women have about the implants are systemic illnesses, which have been reported by many patients, and an increased risk of what's called breast implant-associated anaplastic large cell lymphoma, or BIA-ALCL. The FDA admitted in 2011 that there was, quote, a possible association between implants and cancer, but stated that it wasn't possible to determine a cause and effect relationship and that more information was needed. But in 2016, the World Health Organization concluded that there was a risk of BIA-ALCL associated with the implant. In March of 2019, which is the thing that motivated me to bring this all to your attention, several women testified in front of an FDA advisory panel demanding that the agency ban breast implants that have been linked to cancer and other serious side effects. That doesn't seem like an unreasonable thing to ask. The product that was the subject of the hearing is a textured implant which has already been restricted and even banned in some other countries. At the same hearing, those testifying in favor of not having a ban, of keeping the status quo, were mainly plastic surgeons who said the FDA should proceed very cautiously in considering a ban since the implants are safe for most women. Now, it's not surprising in my mind that plastic surgeons would defend keeping the status quo because for many of them, implant procedures comprise a significant part of their income. So they're conflicted and really shouldn't have much to say about this, in my opinion. The FDA reports that it's identified 457 cases of lymphoma and 9 deaths in the United States that can be clearly attributed to the implants, and that a total of 600 cases and 17 deaths have been reported worldwide. The FDA flatly denies that there's any association between implants and autoimmune disease and connective tissue disease. Now, one thing to consider about FDA and what they report is that most things are not reported to the FDA. So whatever it is that they think they've picked up, usually the incidence is significantly greater. And if you were to get online and just start Googling lawsuits filed on behalf of women who've been claimed to be injured with implants, the problem appears to be much greater. The largest study to date, which included almost 100,000 patients and was conducted at the MD Anderson Cancer Center, showed that while a causative relationship has not been established, there is a clear association between implants and several diseases. The information was taken from the FDA's database dating back to 2005, which is when the moratorium on silicone implants was lifted. At that time, FDA mandated that the implant makers conduct post-approval studies in order to quantify risks associated with them. So according to data submitted to FDA from 2 implant manufacturers, patients receiving one brand of silicone implants had between 2 and 8 times higher frequency of Sjogren's syndrome, rheumatoid arthritis, scleroderma, and melanoma as compared to the general public. Another group of patients receiving another brand that's used mainly for reconstruction had 2 times the incidence of scleroderma, Sjogren's syndrome, and dermatomyositis, for whatever reason that word escapes me right now, than the general public. Those are autoimmune diseases. And only 1 case of breast implant-associated anaplastic large cell lymphoma was reported. The researchers looked at a lot of other issues too and reported that there was no correlation between breast implants and fibromyalgia or suicide, but there was a higher rate of stillbirth, preterm birth, and neonatal intensive care for infants, for women who were pregnant who had the implants. Well, the FDA stated after the hearing that it doesn't believe that textured implants meet the standard for banning at this time. The agency said, quote, it doesn't have definitive evidence demonstrating breast implants cause these symptoms, but added that evidence supports, quote, that some women experience systemic symptoms that may resolve when their breast implants are removed, end of quote, and that women should be made aware of the risk before getting implants. In its announcement, the FDA stated that it had changed the way the breast implant manufacturers make reports to the agency, and that instead of summary reports, the manufacturers would have to file individual medical device reports, which would be made available to the public in a database that the FDA made reference to in its memorandum. The FDA also announced that it would start gathering data in conjunction with some other organizations that are gathering data on this same issue, One is a registry, the patient's registry and outcomes for breast implants, and the other is the Anaplastic Large Cell Lymphoma Etiology and Epidemiology registry. So they say they're going to partner with these organizations to try to gather data and report it to the public. Now, here's what I have to say about this. I think the FDA's response was pretty predictable. This is what happens every time when there's safety or efficacy, when there are safety or efficacy issues that are brought to their attention. The agency admits that there might be some problems and that consumers have a right to know, and that they're going to do better in the future at holding manufacturers accountable and gathering data, and then nothing changes. I mean, this will invariably not change anything, is what history tells us. In the meantime, just because of, I mean, the New York Times did a story on this, so I think more and more women are having the implants removed. I have a good friend who just had them taken out for safety reasons. That's one of the biggest reasons. The other thing is they don't last for a lifetime. So the longer a woman has implants, the more likely that complications will develop, including the leaking issue, and then they have to be removed or replaced. About 20% of women who receive implants for the purpose of breast enlargement have the implants removed after 8 to 10 years. And by the way, insurance will pay for the implants to be put in when you're a cancer patient. They do not pay for the surgery to remove the implants. You get to shoulder the cost for that. There are two primary ways in which the implants can be removed. One involves removal of the implant while leaving the scar tissue intact or the capsule intact. There's less potential for complications related to the surgery, like bleeding this way. The other method is where you remove the scar capsule along with the implant. Women are increasingly choosing removal instead of replacement when they come up for scheduled maintenance, which is understandable. But the problem with just removing it is for women who had really large implants made. When you take those implants out, there's significant deformity because of sagging. And I actually went online and saw some post-op pictures that I think would make most women pretty horrified in terms of what they're, so surgery is required to correct that so that the women can look normal. So here's the thing, at the very least women should be advised before having implants that there are risks, and they're significant. And the fact, we don't have a cause and effect relationship established yet, but there's enough going on that I think women should know. There are reasons to believe that there may be some concerns. And again, since so many of these procedures are for cosmetic reasons, I think, instead of medically necessary, I don't know that they're ever medically necessary, but it's basically cosmetic reasons for most of these women. I think that they should know this. The other thing is that they should know that there's surgical maintenance required. I have never met a woman in the 24 years that I've been here who has issues with implants that was told at the beginning. Now remember, every few years you're going to have these things taken out, and you should watch for leaking, and nobody ever gets those kinds of warnings. So like almost all other medical services, informed discussion would cool a lot of enthusiasm for these implants. I'm pretty sure of it. So proceed with caution, and if you're a person who has an implant, you may want to consider doing something about it in view of this. And one thing that I'll mention is that, and this was the case with my friend, nothing was wrong. That's the time to take it out before there are complications. So that's all for today. Hit the subscribe button if you're not a subscriber as usual. Pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.